Hi everybody, welcome to this episode with the Anxious Resistance, and today I'm going to be talking about genomics. So genomics is defined as the study of genes and their functions and the related techniques to how genes work. Some people get this confused often with the topic of genetics, but genomics is different. They both work with genes, but the main difference between genomics and genetics is that genetics scrutinizes the functioning and composition of the single gene, whereas genomics addresses all of the genes and their interrelationships in order to identify their combined influence on the growth and development of the organism, or in this case, people, humans. I'm talking about this because genomics are used to help determine what kind of medications will work well with your body type, with your genetics. Genomics does this by testing whether your genes are, fully functional, or whether you have a mutated gene, or say a gene in your metabolism that makes you metabolizing a medication go faster than it should or slower than it should. But overall, what the genomics will do is tell you how your body will metabolize and distribute the drug throughout your body. And you also can test the receptors. Whatever receptor the drug is targeting can be tested, so you know if your receptor is dysfunctional or not. It's well understood in the medical community that people react differently to different types of medications. Some people have allergic reactions. Some people, like I stated before, will metabolize the drug too fast or too slow, and it will stay in their system too long. And these are all things that help contribute to the side effects and adverse effects that you get from these medications. Now, I did this back in 2015, and there are several companies that do it. The one that I did it through, that my clinic used, that I was going to, is called Genomic, but there's also another very popular one called GeneSight that's used very often. And what they do is they just take a little swab of your cheek on the inside and get some skin cells there, and then they send that off to the lab. So it's something your doctor can do, and then within a few days or a week you'll get results back from the lab. Okay, so what the genomic lab report thing looks like is this. This is mine here, and it's kind of a bad copy of this, but this is the one that the doctor gave me. But what it does is it kind of goes through the specific genes, and your doctor should know what all these kind of are for. But I think most importantly, the part that maybe you would want to look at if you had one of these tests done is they give you a readout of the medications and what would possibly be effective for you. Now, mine, for example, I got some check marks next to some drugs that say the option may be clinically indicated, so maybe I need it. There are spots where it says this is a drug that is a possible therapeutic agent for you, like your body will metabolize it well and will absorb it well, because your genes are all working fine that work with that specific medication. And what's really cool about this is it gives you quite the list of medications. Mine went through all kinds of different drug categories. It went through atypical antipsychotics, typical antipsychotics, anxiolytics, the drugs for anxiety, stimulants, antidepressants, mood stabilizers, L-methylfolate, which I talk about in another video, which my report showed was a clinically indicated thing for me, and it is something that I find beneficial, and it helps me with my depression symptoms. So you might find things in here that maybe you didn't realize could really help you. And it goes through some other vitamins, some omega-3 fatty acids, whether that's indicated for you. After my years of being on medications, the one I ended up staying on was Prozac. The report was interesting because for Prozac, it tells me that I may need a reduced dose because my body metabolizes it slower, so it stays in the system longer. And what's funny is I'm on a 40 milligram dose of Prozac, and That's a very mid-range dose. I think it caps out usually about 80 milligrams. But maybe that's just kind of what I needed. Maybe I just needed something that was in my system longer and, would stay at a higher level longer to help relieve my symptoms. So it is interesting. And it's something that can be used as a tool to help you and your doctor find something that really is tailored to you. Now, I'm not paid by any of these companies or anything to promote this, but I'm putting it out there because I found it incredibly interesting and even helpful. I'm glad I got a copy of the report so that I could understand and see the results and kind of use that to help guide me as, the psychiatrist and I are looking for a medication to use. Thanks for watching. I hope you enjoyed this content. You found this beneficial. If you did, please like the video, subscribe to the channel, and there's plenty of other educational videos here on this channel, and you can see my full story and kind of what I went through in my 8 years of anxiety and depression. But thanks for watching. I'm glad you tuned in.